to Endocrine Wellness. My name is Dr. K, and today we're going to talk about insulin resistance. The purpose of this video is for educational content only, and please discuss with your doctor for your specific treatment plan. One of the most important aspects of healthy human metabolism is glucose regulation. And insulin is the key hormone to help with glucose regulation. Our body's primary energy source is glucose, which is derived from the foods we consume, and insulin is released by the pancreas in response to the glucose that's coming into our body. When we eat a meal, our food enters the intestines and then enters as glucose into the bloodstream, which causes our blood glucose levels to go up. Insulin is released in response to the glucose going up from your pancreas. The insulin then allows the glucose to enter the cells from the bloodstream, particularly the liver, muscle, and the fat cells. Basically, insulin is the key that opens the doors to those cells so glucose can leave the bloodstream and enter those cells. Once glucose enters those cells, it's being either utilized for energy, for our day-to-day needs, or is being stored as glycogen or fat. So when someone becomes insulin resistant, there is dysregulation of energy utilization, dysregulation of overall metabolism, and how our body handles glucose and fat. What happens in insulin resistance? The glucose is not being utilized efficiently by our body, and the glucose is also not being stored efficiently as glycogen or fat. In the very initial stages of insulin resistance, the blood glucose does not enter the cells. As a result, the blood glucose stays high a little bit longer duration than normal. The pancreas senses that and releases insulin to overcome that insulin resistance. So initially, a little bit more insulin is enough to open the cells and push the glucose into the cells from the bloodstream. But over time, as things get worse, your pancreas is producing more and more and more insulin to try to push the glucose into the cells. There comes a point where the pancreas is producing a significant amount of insulin, and that's still not enough to push the glucose into the cells. What are the risk factors for insulin resistance? Excessive body fat, especially around the middle, high carbohydrate diet, lack of physical activity, a very sedentary lifestyle, smoking, genetics. If you have a first-degree family member type 2 diabetes, then you have a higher risk for insulin resistance. Sleep disorders like sleep apnea. So we get older, we become more insulin resistant. Certain other hormonal issues like Cushing's syndrome or high cortisol production can also contribute to insulin resistance. In certain ethnic groups, or at a higher risk of developing insulin resistance, even at a lower body weight. That would be Asian Americans, African Americans, Latinos, Native American. What is the clinical significance of this insulin resistance? Generally, fat cells are in a fat storing mode whenever there is circulating insulin around, because normally insulin is only produced when we're eating, in a feeding state, when glucose is coming in. But in an insulin-resistant patient, because insulin levels are high for long periods of time, long after they've finished eating or even when they're fasting, the fat cells are constantly in a fat storing mode and they're not in a fat burning mode. And this makes this patient more difficult to lose weight than your average patient that's not insulin resistant. So a lot of patients trying to lose weight and have insulin resistance are frustrated because they can't lose weight. So we have to overcome this insulin resistance to have better results on weight loss efforts. As we accumulate more and more fat, some of this fat does break away and circulate through the bloodstream as triglycerides, and they're looking for muscle cells that need fat energy. Again, this insulin resistant patient is also generally a sedentary person that doesn't do a lot of exercise, so there's no muscle cells looking for energy. So these fat cells are just circulating around and they're picked up by the liver, and over time, this keeps happening. They manifest as high triglycerides in the blood, fatty liver, cholesterol deposits in the blood vessel, causing a multitude of complications. And that's it today. If you find this information useful or you think a friend or family could benefit from this information, please share the video. Please like and subscribe to the channel. If you have any more questions on this topic, please email the channel and I will try to answer them as soon as possible. Thank you for being here.